Hello, and welcome to our currently unnamed podcast. We will figure out a name sometime, maybe take a poll. I am Dr. Allison Heffron, and this is Vinny Tagliaferro, Dr. Vinny Tagliaferro. We both do stuff.
Hello. Yeah, we both do stuff.
We are both rehab chiropractors. I'm also an acupuncturist, and Dr. Vinny is also a functional medicine practitioner. So today we want to take the time to just introduce ourselves, what we're about, who we help, and kind of give you an insight to us as people and not just not people.
Yeah, not just not people.
Yeah.
You haven't mentioned yet that we're married, so if that doesn't come across, then it should.
Yeah, I don't know if me just introducing us comes across, but we're married. We're big Bob's Burgers fans, so quoting Linda.
It's the comfort show in this house.
It is the comfort show. We have two pitties. We have Baloo, like the Jungle Book bear, not the color blue. And we have Frankie, short for Frankenstein. And they're both great. So I love pitties. Just had to introduce them.
They're both rescues, and they came with those names, but those names were also on Allison's list of names for dogs.
Extensive list.
It just happened that way.
Yeah, Baloo. I didn't remember if Frankie actually was, or if I added that after the fact. Okay.
No, it was.
Baloo definitely was. Okay, so yeah, I have a practice here in New Jersey where I treat people in person, and then online we have a program called Limitless Athleticism, and that focuses. Excuse me.
No.
It focuses on helping people who identified as athletic, got injured, went through PT or rehab of some kind, and are still not back to doing all the athletic shit that they were, or not even coming close, and they're very dissatisfied with their current state of being, I guess. And yeah, so that's currently going on. And Vinny, you take on why we decided to make this podcast.
Yeah, so with all those different interactions, right? Like you said, like you're an in-person clinician. You also do virtual one-on-ones with people. We run a group program now, and we're going to go into it shortly. But we've both been through the journey, both as clinicians and also as patients. We've both had our own injuries that we've been able to come back from, and have allowed those injuries, I'll just say, to transform us as people, as opposed to keeping us back or letting us tell ourselves stories that are untrue about ourselves. So
yeah,
in that journey, we really recognized that the mental component, how you think about things, how you talk to yourself, that plays such a tremendous role in how much and how well you recover from the injury that you're dealing with.
Yeah. And also shedding light. And I know that this is going to be helpful for a lot of people, because a lot of people don't have the discussion with their rehab provider around mindset or their emotional turmoil that they're going through. Their rehab specialist may not be asking them the right questions to help them navigate those emotions and what they're going through. But also, we've been in this game I'm a third generation chiropractor, but we have been practicing for over 12 years. And we have a lot of experience treating all different kinds of people. And honestly, I pride myself on being the last stop for a lot of people. They go through rehab and they say that they progressed, but then when they start work, they obviously came to me for a reason. And then when they start working with me or they graduate, they realize the difference between run-of-the-mill PT and high-level rehab. And the goal with high-level rehab is really making long-lasting change for people, and giving them the tools so that they can really take care of themselves and don't need to rely on a particular person to help them feel better. So I know that sharing this stuff can help people who are feeling stuck. And one thing that I will say, and this might sound like a really weird thing to say without you having any context as to mindset, but stuck is a choice.
True.
Yeah. Being stuck is absolutely a decision that you make, and you can make the decision to not be stuck. So just know that.
Yeah, something that you touched on earlier, when it comes to like people working with their professionals, with their therapists or with their clinicians. I think that one thing that really gives you the power back as a client or as a patient is just asking questions, trying to get a better understanding of what is going on with you. And I don't just mean like whatever diagnosis they give you. I mean like trying to get a better understanding of how well things are moving, how do you think about those things moving, whether it's asking yourself questions or asking the provider questions. I think can really start to shed a lot of light on maybe why you're not progressing the way that you would like to progress.
Mm-hmm.
And if you ask those questions and somebody doesn't give you answers or gives you shit for asking those questions, I think that that provides you an awesome opportunity to question if you're working with the right person in the first place.
Yeah. I also think it's really powerful if you ask a question and that person is very honest in saying that they don't know. But
Yeah.
saying that they don't know, and then especially if they follow it up with, but I feel confident trying it this way, like I think that there's a lot of gold in that, and you can definitely feel confident in your provider if that's how they approach life.
Yeah,
Really.
that I don't know. I think I agree with you. It from a clinician's standpoint. Number one, it's super duper honest, right? That person is not trying to blow smoke up your ass, and that's something that is very hard to find nowadays. I feel like between AI, misinformation. I mean, we've been talking, I think, all week about people just being kind of stuck in their own stuff and not having a lot of awareness in the outside world because of, um, just constantly being bombarded with information. So if someone gives you an honest, I don't know, I feel like that is weirdly like a nice break from everything
It's
else.
also like a level of confidence to confidently say you don't know something.
Yeah.
You're not trying to hide who you are. You're like, I don't know. You're just like, I don't fucking know, and that's fine. That's fine. I'll learn. Um, so yeah, a little bit of a detour from that because we'll be diving into that kind of stuff as we move forward in these episodes. But some backstory on us. Sorry, I keep clearing my throat. Um, and I have seltzer, which isn't helping. So in 2022, I started roller derby, and I literally shattered my ankle. It was broken in 5 places, and one of the areas was actually in pieces, and I dislocated it. And now I am actually training to compete in my very first bodybuilding competition. So I have been the person before injury, during injury, and after injury. And so that, that's an experience that, and I'm also a clinician. I've been the patient and the clinician. So I do think that having those experiences can provide a lot of insight to people who are going through it.
Yeah, definitely. And then on my side of things, I've dealt with a lot of injuries throughout my career. At one point, I thought I was going to be a professional hockey player, so I did all of the things that I thought that I needed to do to get to that level, including dealing with injuries, coming back from injury way too soon, not properly rehabbing things, and ultimately getting hurt again as a result of it. During the lockdown, during the pandemic, I had a lot of issues that I dealt with regarding mental health, regarding neurological health. And now I have come to the other side of that. And throughout that journey, a really big part of the process was recognizing that it wasn't just the therapies that I was doing for my physical body that helped me get to a place where I am now way better than before, it was also taking a look into the mindset, the mental health, the how you think about things, the why you think about things, the way that you talk to yourself about it. All of it's just so tremendously important and really shapes how well you can progress on the physical side.
And even beyond that, I don't know if anyone's listening to this for this piece of information, but honestly, Vinny working on himself that way bled into me working on myself that way, and it's only elevated our relationship. So, and elevated the relationships around me. It makes me more. I'm not sure what the word is. Not decisive, but just makes me choose who I want to be around.
Yeah, you have a different level of awareness now than you did before, right?
Yeah.
Like you can recognize what's more important to you and find those qualities in other people more easily.
Yeah.
Too.
Yeah. And you make better decisions of who you put your energy into and what you put your energy into.
Who you surround yourself with.
Yeah. So, aside from that, we also want to add a little bit into every episode of just, some what our interests are. So, in the realm of, I don't know, pop culture. Is that pop culture? No, it's probably
I
it's
guess
just
so.
like, I don't know, like TV shows, movies, books, music. So we'll add a little smidge of that. It doesn't have to be one from every topic every time.
No.
So we'll each just share something that we are reading, listening to, whatever at the moment that we'd like to share. So I'm going to go first.
You do it.
And I'm going to go with a band that I've been really enjoying lately, and that's Emil and the Sniffers. And if you like punk music, she's badass. She's great. She's from Australia, and she's awesome. And the whole band is awesome. So I would recommend them. And Vin, what are you listening, reading, liking, whatever these days?
That's a good question. I'll say.
He's checking ChatGPT.
Just because you mentioned Emil and the Sniffers, her album from 2024, Cartoon Darkness, their album, I should say, Cartoon Darkness is really, really great, and they're touring right now. So if you want to support them, do it.
Cool.
Yeah. For my side of things, I mean, hockey playoffs is going on right now. Diehard Flyers fan. I have Gritty tattooed on my foot, so you can come at me with it. I don't care. Let's go Flyers. And yeah, I don't think we talked about it in this third recording of this first episode, but
a lot of learning.
There's so much. But Allison's a big Housewives woman, so
I'm a Housewives bitch. I love Housewives.
Yeah,
Real Housewives of Rhode Island is that. By the way, there's a new episode. We got to watch it.
Okay. So yeah, that's something that I also participate in. I watch a lot of the Real Housewives franchises.
He says that he participates, but like reluctantly, but he enthusiastically gives commentary. So
yeah, I was very very stubborn at first about resisting it, and then once we realized that the trade-off was hockey for Housewives, it's been gold ever since.
Yeah.
And yes, I do get invested. I will talk about the gossip. I don't give a shit.
That's great.
Yeah.
Cool. Well, you're trying to what?
No, I think that's good.
Okay. So if you have any questions about what you're currently going through with regards to your injury, your recovery, anything in those topics, please leave your questions in, I guess, the comments. I don't know. We're new to this. I think there's comments, so you could do that, or DM me on Instagram at dr.allisonheffron, ALLISONHEFFRON, and doctor is dr. dr.allisonheffron.
Good job, you got it.
Yeah, I got my name. So DM me there, or if there's comments, questions, if there's a box below, then do that, and we will talk about it on here. And super excited to have you guys follow along if you are invested in this at all.
And if you're not, that's fine. We're going to keep going anyway.
Yeah, definitely. All right, signing off. See ya.
Toodles.